Hello, my name is Harriet. I'm a specialty registrar in paediatric dentistry working across both the Birmingham Dental Hospital and the community dental services. I'm here to give you tips on what makes a good referral for paediatric patients. Our goals will be the same: to get your patients seen in the most appropriate service as soon as possible based on their clinical needs. If we start at the beginning, paediatric dentistry is for children who are yet to reach their 16th birthday. As well as patient name and address, we ask for the child's legal guardian's name. It's important that all clinicians know who can give legal consent for the child or who has parental responsibility. We also ask whether the family receive any support from the local authority, such as social services or children's trusts. If you know the child has a named social worker or family support worker, please include their contact details so that we can contact them to support the child's attendance. Please inform the family when you refer that the legal guardian for the child must attend the first appointment for us to gain consent, because we need this, even for radiographs. Grandparents and other family members cannot routinely consent for the child unless they have a special guardianship order, and in which case they will need to bring this document with them to the first appointment. We ask for the school name so that should we have any safeguarding queries, we know who to speak to for support. If the family require an interpreter, please state yes and which language they require. We need to arrange an independent interpreter rather than relying on friends and family. Please include all relevant medical history, including any medications the child may take and the name of any clinicians the child sees, for example, a paediatrician. This will help us to gain further information if required, and along with the dental information, this will help to ensure the patient is seen in the best clinic with the appropriate clinician for their first appointment, such as at the Birmingham Dental Hospital, rather than being seen by their local CDS, or even transferred to Birmingham Children's Hospital should this be more appropriate. Please detail if they have any additional needs such as autism and how cooperative they are at the dentist. From this, we can make appropriate adjustments for their visit. Now that we have the relevant background information, we can move on to the clinical reason for your referral. Please state clearly the reason you're referring, such as caries and in which teeth. If the child is experiencing pain or has needed antibiotics, please let us know so that we can clinically prioritise these patients. If they have not had any symptoms or the carious lesions are restorable, this is also helpful for us to know beforehand. Please detail what treatment you have provided already or attempted. We do ask that an attempt is made to provide treatment if appropriate. Radiographs are essential for helping your referral to be triaged appropriately. The FGDP guidelines recommend taking radiographs in paediatric patients whenever caries is suspected or present. Radiographs are also useful for assessing other dental conditions such as supernumeraries or missing teeth. Please attach any radiographs that you had taken, as many referrals are delayed because the X-ray is not attached to the referral. Please make sure that your referral is not one of these. If you are struggling to take radiographs, have you tried using a small size 0 film, as these are very handy? Sadly, COVID has left everyone with long waiting times. It is essential that whilst your patient is waiting to be seen, that you continue to provide their routine care and prevention in line with Delivering Better Oral Health Toolkit, such as regular fluoride application. If they have any urgent issues, please see them as you usually would, but if you feel that the referral now needs to be seen more urgently or the clinical picture has changed, you can let the booking teams know of this. Please check your Rego account regularly, as you may be contacted for further information if it is missing from the referral. You will also be able to see if your referral has been passed to a different service so the child sees the right person first time. This is also useful information for the legal guardian. The first appointment is for assessment only. Rarely do children receive treatment on the day. Please ensure that the parent or legal guardian knows this so they are not disappointed. Not all clinics are equipped to the same standards. For example, sedation equipment or specialist services are only accessible at certain clinical sites. Please bear this in mind when making referrals and managing parent and legal guardian expectations. By including all of this important information in your referral, it can be triaged promptly and swiftly. It will ensure that children are booked in the most appropriate service with the most appropriate clinician and hopefully avoid further delay for patients. Thank you for listening. I hope that you will find this information useful for your future referrals.